Good morning everyone, I'm Lance Matthews and today we're going to discuss some crucial changes coming to GP services across the NHS that will directly affect our senior citizens. These new regulations, set to take effect in February 2025, represent the most significant overhaul of primary care services in the past decade. Whether you're a senior citizen yourself or caring for an elderly loved one, understanding these changes is absolutely essential for maintaining proper access to healthcare services. Before we dive into the details of these new regulations, I want to emphasize that these changes have been designed with one primary goal in mind: improving healthcare accessibility for our senior population while ensuring the sustainability of our beloved NHS. However, as with any major system change, there will be adjustments we'll all need to make in how we interact with our GP services. Let's begin with perhaps the most significant change: the introduction of the Senior Priority Access Scheme, SPAS. Under this new initiative, all NHS patients aged 70 and above will be automatically enrolled in a priority booking system. This means you'll have access to dedicated appointment slots specifically reserved for senior citizens. These slots will be available during the quieter morning hours, typically between 8:30 a.m. and 11:30 a.m, when many GP surgeries report their highest staffing levels and shortest wait times. However, it's crucial to understand that this new priority system comes with certain responsibilities. All senior patients will be required to participate in an annual health review, which will be more comprehensive than the current over 75 health checks. These enhanced reviews will include cognitive assessments, medication reviews, and detailed discussions about preventive care measures. While this might seem like an additional burden, it's actually a proactive step to ensure potential health issues are caught and addressed early. Another significant change involves the introduction of the Digital Health Companion Program. Now, I can almost hear some of you saying, "Oh no, not more technology," but please bear with me. The NHS has recognized that not all seniors are comfortable with digital services, which is why this program has been specifically designed with simplicity in mind. Each GP practice will now have a dedicated digital health assistant who will help senior patients navigate online services, from booking appointments to requesting repeat prescriptions. The Digital Health Companion Program isn't just about teaching technology skills, it's about providing additional support. These assistants will be available during regular surgery hours to help with any digital queries, and they'll even conduct home visits for those who are housebound or have mobility issues. This service will be entirely free of charge and is aimed at ensuring no senior citizen feels left behind in our increasingly digital healthcare system. One aspect of the new regulations that has generated considerable discussion is the introduction of the Family Link Scheme. This innovative program allows designated family members or carers to have limited access to their elderly relatives' GP services. This means they can help manage appointments, request repeat prescriptions, and receive important healthcare communications on behalf of their loved ones. However, it's important to note that this access will only be granted with the explicit consent of the senior patient, and they can revoke this access at any time. The Family Link Scheme addresses a long-standing concern among many families who help care for elderly relatives. Often, these family members have struggled to coordinate healthcare services due to privacy regulations. Now, with proper authorization, they can be more effectively involved in their loved one's healthcare journey. This is particularly beneficial for seniors who might have memory issues or find it challenging to manage their healthcare appointments independently. Another crucial aspect of the new regulations involves medication management. Starting February 2025, all seniors who take 3 or more regular medications will be automatically enrolled in the Enhanced Medication Review Service. This service includes quarterly medication reviews with a clinical pharmacist who will work alongside your GP to ensure your prescription regime is optimized for your specific needs. These reviews will take place either in person or via video call, depending on your preference and mobility. The Enhanced Medication Review Service represents a significant step forward in preventing medication complications, which are unfortunately all too common among our senior population. The clinical pharmacist will not only review your current medications for potential interactions, but will also assess whether any medications could be safely reduced or discontinued. This is particularly important as we know that taking multiple medications, known as polypharmacy, can sometimes cause more problems than it solves. One of the more innovative aspects of the new regulations is the introduction of the Wellness Support Network. This program recognizes that good health isn't just about medical treatments, it's about maintaining an active, engaged lifestyle with proper social support. Under this scheme, GP practices will partner with local community organizations to provide seniors with access to various activities and services, from exercise classes to social groups. The Wellness Support Network will be integrated directly into your GP care plan. During your annual health review, your GP will discuss suitable activities and make appropriate referrals. These might include chair yoga classes, walking groups, art therapy sessions, or even cooking classes focused on healthy eating for seniors. The best part, many of these activities will be either free or heavily subsidized for NHS patients over 70. Let's talk about emergency care access, as this is an area where significant changes are being implemented. The new regulations introduce what's called the Rapid Response Protocol for seniors. Under this protocol, if a person over 70 contacts their GP practice with urgent health concerns, they must be assessed either in person or via telephone within 2 hours. This is a marked improvement from the current system where wait times for urgent cases can vary significantly. However, it's important to understand how to use this new protocol responsibly. The Rapid Response Protocol is specifically for urgent medical concerns that don't quite warrant a 999 call but need prompt attention. Your GP practice will provide clear guidelines about what constitutes an urgent case, and the reception staff will be specially trained to help you determine whether your situation qualifies for rapid response. One aspect of the new regulations that might initially cause some concern is the change to home visit policies. While home visits will still be available for those who truly need them, there's now a more structured assessment process to determine eligibility. This change aims to ensure that home visits are reserved for those who genuinely cannot attend the surgery, allowing GPs to use their time more efficiently. To compensate for these stricter home visit criteria, the NHS is introducing an enhanced transport support scheme. This will provide free or subsidised transport to GP appointments for seniors who have mobility issues but don't qualify for home visits. The service will include door-to-door assistance and will be operated by trained staff who understand the needs of elderly patients. Mental health support is another area seeing significant changes under the new regulations. Recognizing that mental health issues often go undiagnosed in the elderly population, all GP practices will now have dedicated mental health practitioners specifically trained in geriatric mental health. These specialists will be available for both scheduled appointments and crisis intervention. The Mental Health Initiative includes the introduction of regular screening for common conditions like depression and anxiety during routine GP visits. This proactive approach aims to identify and address mental health concerns before they become severe. Additionally, group therapy sessions specifically designed for seniors will be available at most GP practices, providing both support and social interaction. Another significant change involves the management of chronic conditions. The new regulations introduce the integrated care pathway for seniors with long-term conditions such as diabetes, heart disease, or arthritis. This pathway brings together various healthcare professionals, from GPs and nurses to physiotherapists and occupational therapists, to provide coordinated care under one roof. The integrated care pathway means you won't need to visit multiple locations for different aspects of your care. Instead, specialists will come to your GP practice on designated days, making it easier for you to access all the care you need in one familiar location. This approach not only reduces the burden of traveling to different appointments, but also ensures better communication between all healthcare professionals involved in your care. Let's discuss the new appointment booking system, as this represents a significant change from current practices. While the NHS is encouraging the use of online booking systems, they recognise that many seniors prefer to book by phone. Therefore, all GP practices will be required to maintain both booking options, with dedicated phone lines for senior patients that have priority answering.